Sometimes the only thing standing between you and emotional stability is a snack and a good night's sleep. Hi, I'm Dr. Kiki Fehling, psychologist, author, and expert in dialectical behavior therapy, or DBT. Physical self-care is emotional self-care. In this video, I'll be teaching you the PLEASE skill from DBT, 6 ways to take care of your mental health by taking care of your body. PLEASE stands for treat physical illness, balance eating, avoid mood-altering substances, balance sleep, get exercise, and balance sensory input. Let's talk about each one. The first PLEASE skill is treating physical illness. When your body feels like garbage, your emotions follow suit. It's way harder to cope when you're dealing with a headache, stomach pain, or chronic illness flare. This skill is about taking your physical health seriously. Take your medications as prescribed. Go to medical appointments. Don't ignore symptoms when they show up. Rest when you're sick instead of pushing through. Your brain and body are connected. When one struggles, the other does too. Treating and preventing physical problems gives you a solid foundation for emotion regulation. The second PLEASE skill is balanced eating. Being hangry is a real thing. Your blood sugar really can impact your mood. Sometimes eating a snack can change everything when you're upset. But it's also important to make sure that you're eating well consistently. This skill is about eating in a way that works for your body. Try to regularly eat meals that cover all of the nutrients you need, avoiding specific foods that make you feel sluggish or irritable. You absolutely don't need to follow a specific diet or to eat perfectly. It's about doing the best you can to nourish your body so that you can actually enjoy life and handle whatever stress it throws at you. The third PLEASE skill is avoiding mood-altering substances. Drugs impact your mood, period. This skill doesn't demand that you go sober. It simply asks you to start paying attention and to make changes if needed. A lot of people use drugs to cope with difficult emotions. While they can help you feel better in the short term, they often make painful emotions worse in the long run. Even caffeine, nicotine, and alcohol can all greatly disrupt your sleep and cause your emotions to go haywire. This skill is to do your best to be honest and to avoid whatever substances are making your mental health worse. Of course, if you're struggling with addiction, this skill becomes even more important, but also harder. In the description box below, you'll find some resources for finding professional help. The fourth PLEASE skill is balanced sleep. When you're exhausted, everything feels harder. Emotions become overwhelming when you're sleep deprived because your body has significantly fewer resources to work with. This skill is about preventing that. Try to get 7 to 9 hours of sleep per night. Try to practice good sleep hygiene, keeping your bedroom cool and dark, limiting screens before bed, and trying to wake up and go to sleep around the same time every day. Everyone has different sleep needs, but we all need sleep. Maintaining the best sleep schedule for you can make a huge difference for your mental health. The fifth PLEASE skill is get exercise. Exercise is a powerful mood regulator. It releases endorphins, reduces stress hormones, and gives you an outlet for stress. You don't need to become a fitness influencer. Even moving more in small ways can make a huge difference. Try to stand up, move around, or stretch your body more throughout the day. If you're able, doing more intense exercise regularly helps too. Try to go on a walk, dance, lift weights, or do something that gets your heart rate up at least a few days a week. The key is finding movement that you actually enjoy so that it feels nourishing rather than punishing. The final PLEASE skill is balance sensory input. Your senses are constantly taking in new information: sights, sounds, tastes, smells. It's easier to get emotionally overwhelmed when your senses are bombarded. This is especially true if you're autistic, have ADHD, or are just highly sensitive. This skill asks you to pay attention to the sensory input around you. Is it super loud? Are there bright lights bothering you? Are your clothes itchy? And making small changes to reduce negative sensory input can make a huge difference for your overall emotional stability. You can also try to incorporate more self-soothing into your day. It's about balancing your sensory input so that you don't get either over or understimulated. And then you feel more centered and grounded throughout the day. So there you have it, the PLEASE skill from DBT. The PLEASE skills are emotional regulation. When you're tired, hungry, hungover, or sick, even small stressors feel like major crises. But when your physical foundation is solid, you have way more emotional bandwidth to handle life's challenges. Keep in mind, physical self-care can be hard, especially if you struggle with depression, addiction, or other mental health difficulties. It's often helpful to just focus on one of the PLEASE skills at a time. Be kind and patient with yourself as you try to practice. In the meantime, DBT also has dozens of other coping skills that can help you cope with stress and painful emotions right now. I teach many of them in my books and other videos if you want to learn more. But if you want to find a therapist, check out Recovery.com or the resources below.